आफ्टरनून। मेरा नाम कीर्ति है। आज
Good
मैं
afternoon.
राज हॉस्पिटल की डॉक्टर सुप्रभा चक्रवर्ती के साथ लाइव सेशन करने जा रही हूँ, जिसका टॉपिक है प्रिवेंशन एंड ट्रीटमेंट ऑफ ट्यूबरकुलोसिस। So, doctor, please introduce yourself.
Yeah. Good afternoon, everyone. Myself, Dr. Suprova Chakraborty. I'm a consultant pulmonologist in Raj Hospital, Ranchi. And today we are going to talk about this is World TB Day, so prevention and treatment of tuberculosis. Thank you for inviting me. Please go ahead.
Yeah, so doctor, मेरा first question है, is TB curable?
If properly treated, on time treated, and the medicines taken properly, then most of the TB cases are curable and treatable, preventable as well.
Okay, and is TB deadly?
Tuberculosis is a disease caused by a bacterium, Mycobacterium tuberculosis. So, if this is a very contagious disease, it can affect any organ of the body, but mainly lungs is primarily affected. And when it involves, other organs, it is not like spine, bone, or brain. It is not contagious. But if it is in lungs or throat, it is contagious when someone is coughing, laughing, or talking. So in that case, and if treated untimely is not treated and the medicine is not taken properly or in the proper dosage, then it becomes deadly. We can see, like according to World Health Organization, nearly 16 lakhs people are dying every year for this disease. And in a huge rate, multi-drug resistant and extensively drug-resistant TBs are also increasing. So it is, concern of the time.
Okay, sir. Thank you. What are the challenges to treat TB?
Mainly, tuberculosis, this is a number of medicines are there to treat, and there are different category to treat also. So there are innumerable research are going on with the new molecules. As you know, it is a very old disease, but for many years, doctors and scientists have been searching for a definite cure. And because it is possibly bacillary and it has many various ways, TB, shows its symptoms in various ways. So there are a number of medicines can be given, and there are first line drugs, second line, and alternative medicines. So whenever someone suspected of tuberculosis, doctors starts with four combination of medicines, and they see for if it is responding or not according to the patient's response, the course of the disease and the treatment being decided. So most important for the patient is to see if the tolerance, they should tolerate the medicine, and there are certain ways to to increase those tolerance of the medicine, to look at that. And then if in spite of giving the medicine something is not improving, then to look for the drug resistance, because nowadays drug resistant TB is also very common, and there are many new drugs in the market available there for to treat this TB. And especially many people, they don't know government India and World Health Organization how they support the totally TB treatment. And monthly, when a person is going through this TB treatment, they can get a 500 rupees monthly benefit as well for their nutritional purpose. And even the whole medicine can be, they can get just free of cost from any government registered place by doing the proper registration in Nikshay ID. So people may come forward and get their knowledge about the disease. There should not be some social stigma about this disease. So that is the main important thing to treat and battle against it.
Okay, thank you. So, मेरा next question है, what are the preventive measures to avoid TB?
Most of the time, TB is so common that we have to most of us are exposed with the antigens in our country. This is an endemic TB country. So what happens if your immunity is perfectly okay? So that exposure, that is we call in clinically latent TB, that is TB germ is there inside your body, but it is not manifested as a disease per se. So that can be hidden in your body. But when for some reason is going through some other diseases, let's say some diabetic or some kidney transplant has happened, or CKD patient or cancer patient, or some other reason, some chronically steroid or some immune suppressants are going on, or the immunity is down because of some recent infections. So sometimes what we see that when the immunity of the body goes down, then these TB germs gets activated. And especially, there are some associations. It has been found that homeless people, people living in poor general condition, and increasing air pollution, who are using this coal and woods fuel for their regular cooking purposes, the people who are smoking, and poor hygiene, and poor vitamin deficiencies like vitamin D deficiencies. These are all associated with TB predisposition. So the main thing is proper hygiene to improve the living condition, to avoid kind of air pollution. And if any person is having who is in your contact, who is already diagnosed with TB, so especially if is a lung TB, so that anyone starting from a child to the elderly and the adult people of the family should go and get checked if they are having already the symptoms of TB, of active disease or not. If not, many a times it is necessary to take the preventive medicines of TB. And most of the cases, if someone is having a patient of multi-drug resistant TB in their family, so it is compulsory for all the family members, including children, to go and check for active disease. If it is not there, to take at least 6 months preventive medicine for TB, so that they don't get that disease. So that is the main prevention, to maintain a proper nutrition, to maintain proper hygiene, hand wash. And if someone is in contact who is having the active disease, to maintain all the hygienic norms, not to spread the disease further, to keep him in a well ventilated place, to keep all his separate belongings. So these are the main preventions.
Okay, so मेरा next question है डॉक्टर, is TB contagious?
Yes, it can be dangerous if it is not diagnosed timely, or even after diagnosis, someone is not able to take the treatment properly. And if, let's say, he is not contaminated with the normal TB, again comes the drug resistant pattern. What happens most of the time, people still in our society having a stigma that TB cannot be, disclosed to other people, that it is a shame kind of thing. So this, there is nothing like that. It's simple a bacterial disease which can be preventable and treatable on time if taken proper medicines. So what is the problem is the adherence to treatment. So people are reluctant to take the TB medications on time because there are a lot of side effects also. Initially there are problems like bloating, and appetite is decreased, and people feel nauseated, and sometimes vomiting also happens. But there are even ways to take the medicines, some empty stomach, sometimes without with food also some medicine can be prescribed. So there are some ways. There is like, let's say, early morning empty stomach is someone taking the medicine and they sleep, and after that they get up and they get their breakfast. That is another way. Sometimes it is advisable that you take one by one medicine, take a sip of water, or you take some glucose biscuit along with the medicine to reduce your nausea. Like, the point is to tolerate the medicines and to help your doctor to help you. So how to tolerate the medicines in your way, because everyone's body system is separate. So not to be in despair that I cannot tolerate the TB medicine, because if someone leaves midway and they do not complete the treatment, what happens, it can turn into incomplete treatment. It can turn into dangerous multi-drug resistant TB. It can be disseminated TB, that is, in from one organ it can spread into whole body or other organs. So that way it can become more contagious or more deadly for a person. And there are a lot of cases nowadays like that. So patient has to be very much motivated and compliant. This is our job also, even family members job also, to constantly to motivate them that there is no shame, it's just a disease they have contacted with. So with the good proper nutrition, with the good family support and motivation, every TB patient can be, try to treat their disease and come into a normal life again. Even the drug resistant TB has a lot of cure. Even multi-drug resistant and extensive drug resistant TB also is having cure. So we need to work as a team. The doctor, the patient, and his home attendant, family members, friends, everyone, to get this all together. Because it's not a 1 day or 2 days problem, it's a long time, sometimes it's a lifetime battle. And we have to be very cautious not to hide the disease, because if you are hiding, if you are more contaminating, you are becomes a danger for the society also, for the families also, and for your own health also. So that is the social responsibility we need to develop among everyone, and need to know that this is how much preventable, treatable, and curable. Thank you.
ओके, तो मैम आप कुछ और मैसेज देना चाहती हैं और ऑडियंस को वर्ल्ड टीबी डे पे
This
कुछ
is,
मैसेज?
देखिए, yes, it's a worldwide problem, and we are one of the main team member associated with World Health Organization. पूरा टीम में, विश्व में इसका चर्चा इसलिए चल रहा है कि देखिए कि it has become such a challenge. We know about COVID, but we don't know that COVID के बाद ही टीबी ऐसे एक बीमारी है जिसमें हर साल इतने मरीज जान गंवाते हैं। 2 करोड़ जैसा बीमार इंसान है टीबी का, 15 लाख 16 लाख जान जा रहे टीबी के कारण, बीच नजरअंदाज हम इसको नहीं कर सकते। एंड उसका कुछ तरीका है, ये बहुत पुरानी बीमारी है, एंड जिनका ट्रीटमेंट भी ग्रेजुअली बहुत साल के रिसर्च एंड डेवलपमेंट से अभी भी चल रहा है। देयर आर स्टिल रिसर्च एंड डेवलपमेंट्स गोइंग ऑन न्यूअर ड्रग्स। कैसे ड्रग्स का साइड इफेक्ट कम किया जाएगा, कैसे आपका और भी कम टाइम में दवाई लेकर हम टीबी को ठीक कर सकते हैं, ऐसे बहुत सारे तरीका है। अगर वेरी पुअर पेशेंट्स भी कोई है, उनके लिए भी सरकार की तरफ से टोटली मदद किया जाता है, क्योंकि आपकी ट्रीटमेंट होता है फ्री ऑफ कॉस्ट। यू कैन गेट ऑल द मेडिसिन। आपके टेस्ट होता है कोई भी सदर हॉस्पिटल में, देयर आर मल्टीपल, जैसे स्पूटम टेस्ट, सीबीनेट कॉस्टली टेस्ट है, वो सरकारी में आप फ्री में करा सकते हो। एंड देयर आर सम मॉनिटरी बेनिफिट्स ऑल्सो, कि आपके महीने का खाने पीने के लिए भी आपको 500 रुपीज करके हेल्प किया जाता है सरकार की तरफ से, जो कि बहुत सारे लोगों को पता नहीं है। एंड अगर आपको एक कोई भी ड्रग से इंटरेक्शन हो रहा है, उसका भी ऑल्टरनेटिव ड्रग्स है, मेडिसिन है, मेथड्स है, हाल सोल्यूशन ऑल तरीके से है। सिर्फ ये है कि आपको धीरज रखना है। यू नीड टू कीप पेशेंस, you need to be motivated, and आपका न्यूट्रिशन शुड बी प्रॉपर टू फाइट विद दिस डिजीज। सो दिस इज अ टोटली टीम वर्क। कभी भी आपको टीबी का शंका है तो आप हार ना माने। कभी भी आपको खांसी है विच इज नॉट 2 हफ्ते से ज्यादा हो रहा है, या आपको साथ में सांस फूल रहा है, या आपकी खांसी के साथ कभी ब्लड आया है, या आपको हल्का हल्का रात में बुखार लगता है, आप नापते हो तो बुखार आपको महसूस नहीं हो रहा है, दिन के दिन आपका वजन घट रहा है, या आपके अंदर बहुत ज्यादा थकान महसूस होता है, आपका बिस्तर जो है वो पसीने से गीला हो जा रहा है, इनमें से कोई भी एक सिम्टम, जरूरी नहीं है कि सब, प्लीज ध्यान दीजिए, इनमें से कोई भी एक सिम्टम अगर आपको है, प्लीज आपके डॉक्टर से संपर्क करें टू रूल आउट कि आपको टीबी तो नहीं है। बच्चों में नॉर्मली देखा जाता है बच्चे का ग्रोथ नहीं होता है, बच्चा दुबला होते जा रहा है दिन के दिन, उसमें फीवर इतना प्रोमिनेंट भी नहीं हो सकता है, बट उसका जो एज के हिसाब से उसका हाइट एंड वेट होना चाहिए वो नहीं होता है। तो वैसे बच्चों को भी हमेशा जांच करना चाहिए। और जिनके घर में ऑलरेडी टीबी की बीमारी का हिस्ट्री है, या कभी पहले डेथ हो चुका है बिकॉज ऑफ टीबी, उनके हर एक फैमिली मेंबर का ये रिस्पॉन्सिबिलिटी बनता है, प्लीज आप जाइए और जांच करवाइए कि आपका टीबी है कि नहीं, संभावना है कि नहीं, आपको प्रिवेंटिव टीबी का मेडिसिन लेने की जरूरत है कि नहीं। थैंक यू।
थैंक यू मैम।